गुड इवनिंग एवरीवन। सो आज का सेशन हम सो लेट्स स्टार्ट टुडे सेशन। आई विल presentation to Soumya. Please Soumya, please start your presentation right now.
Okay. A very good evening to all the games members, representatives of Miss Next, as well as all our successful participants. I, on the behalf of Games Organization and Miss Next, would like to congratulate you all for showing your active participations in the quiz. We have successfully went through the event aiming towards Cervical Cancer Awareness Month. As we all know that we are celebrating this month as a Cervical Cancer Awareness. So, first of all, today I will be throwing some words on cervical cancer, just giving you all a short brief on it, like what cervical cancer is. So, I will be starting. So, cervical cancer. So, the month of January, as I have already told you, is celebrated as Cervical Cancer Awareness Month, and cervical cancer develops in women's cervix, the entrance to the uterus from the vagina. Almost all cervical cancers, like approximately 99%, are linked to infection with high risk of human papilloma viruses. Hope everyone must be knowing that. And an extremely common virus transmitted through sexual contact. Although most infections with HPV resolve spontaneously and causes no like severe symptoms or something, and there isn't persistent infection cause cervical cancers in women. So, cervical cancer is one of the most successfully treatable forms of cancer so far, and it is detected and if it's detected early, and it can be managed effectively, and these cancers diagnosed in late stages can also be controlled with appropriate treatment and like palliative care as well. So with a comprehensive approach to prevent, screen and treat, we can end cervical cancer as a public health problem within a few generations or so. That's why we are heading towards this, so that in near future we should eradicate this thoroughly, and there shouldn't be any risk of cervical cancer anymore in future generations. So, I would be talking about some risk factors. Hope everyone must be aware. One, I have already told you about human papilloma virus, that is the most common risk factor of this. Other is multiparity, promiscuity, postpartum puerperal sepsis, socioeconomic status, in utero exposure to diethyl sorbitol, and smoking, oral contraceptive pill users, like for long term, those women used to be habitual to this, they are also at a greater risk of getting cervical cancer, and obviously immunocompromised individuals as well. So there are a few facts that I would like to mention. So first is it is the most common gynecological or genital cancer in the world. It's the fourth most common cancer in women worldwide. Is the most common cause of menopausal bleeding in Indian women. Most common cause of pyometra in Indian women as well. And it is most common. We are having most common histological variant of in cervical cancer is that of squamous cell carcinoma of cervix. And lastly, that is most common site of adenocarcinoma is endocervix. So these are some facts that is very known, and I think everyone should be aware of all those things. So I will be heading towards human papilloma virus, like what is it, how, like what are the factors because of what it gets so infectious in women. So HPV, a large number of cervical cancer is caused by this. I have already mentioned. So it is the most common causative agent responsible for carcinoma of cervix with a 99.7% of risk factor. After that, this infection clears up on their own, and mostly these are precancerous. And after that, it inhibits the tumor suppressor genes like P53 and RB genes, thus leading to progression of cancers in females. It's having a few proteins like L1 and L2 that helps in its adherence. Proteins E1 and E2 that helps in replication of this virus, and there are E6 and E7 proteins respectively that like inhibits P53 and RB genes. So these are few things about HPV. And lastly, I would be mentioning some things like sign and symptoms of it. So in case of cervical cancer, the very common signs and symptoms are irregular and postmenopausal bleedings. After that, there is increased vaginal discharge. It could be offensive as well. More severe symptoms can be arised at advanced stages. Cancer can be pap smear test, that is 47 to 63% sensitive towards uh, like cervical cancer, and its sensitivity could be increased as well. And after that, if pap smear test is abnormal, then one can proceed with the biopsy. That is, if in case the lesions are visible, then there could be punch biopsy, and if the lesions are invisible, then they can go for VIA and VILA. So VIA is visual inspection under acetic acid, due to which there under acetic acid, if it is seen, then there is whitish color of uh, cervix, which leads to diagnosis of that thing. And if it is not there, so one can go for VILA as well. In general, in general, these tests are used mostly in rural areas. So VILA stands for visual inspection under Lygol's iodine, which shows dysplastic changes. If there is dysplastic changes in cervix, so it could be demarcated as yellowish type. So one can diagnose cervical cancer in these cases also. So after that, there is colposcopy and cone biopsy, that is used to confirm findings of colposcopy as well. So these are few diagnoses. And one thing that is very important to know, at least for every woman, that is like how to keep yourself safe. So that is getting HPV vaccinations, that is 3 shots. Uh, and if you are sexually active, then you can use condoms or such things to reduce the risk of HPV. So these are few things that everyone should know about cervical cancer. And rest, you guys are like watching over the screen that there is HPV vaccine schedule, that is cervarix and Gardasil are the most commonly used and most safest approved so far. So like there, the age criteria, doses, and like how to go for, that is that is shown over the screen, so you guys can have a look at the screen. So now I will be ending this like presentation at this point only, to throw some words for us and to guide us on for a better platform. Thank you.
Thank you, Dr. Soumya. Thank you so much. Thank you, Dr. Amritanshu, to inviting us. And I just thank you all participants. And we are very happy to announce. I hope I'm audible.
Yes, ma'am.
Yes, ma'am.
Okay, thank you. So we are very happy to announce the winners who are winners are quiz, and I just want to please announce from your side the winner because they are friendly with you. Okay, I'm Preeti from Mist Next, and Mist Next is a platform where you can prepare yourself for your licensing exam. I hope you all students are aware with that after completing your degree, you have to clear a licensing exam to practice in India. And for that, we are preparing students since last from 10 years. And with the God grace, we are on number one platform. And we just want, and this Miss Next app, this is a pre-recorded video lecture plan, which we launched 1 year back only. And this is the idea behind launching this platform is because the students wants to study with their medical degree for their licensing exam. They don't want to start their preparation in a 6 month, in last 6 month. So that's why we started this platform. So I just want to share a screen. Okay, is my screen visible?
Yes, ma'am, your screen is visible.
Okay, thank you so much. So, as I told you that Miss Next is a pre-recorded video lecture plan. Here is mentioned NEET PG and Next because I hope you guys know there is a draft came out few days back before the FMG exam that maybe they will launch their next exam in 24, 23. They didn't announce any date. They just want a suggestion with the public that what draft they published is that fine to all, so we can launch they can launch that, or they have to like identify, they have to modify some things in that. So that's why like if you are in third year, second year, first year, then you can start with, sorry, do you have any question, doctor? Okay. So yeah, if you are in third year, second year, first year, then you can go with the NEET PG section, or you can go with the FMG section also. As of now, we have a FMG section. But yes, it's very true that if they announce the date of next exam, then definitely we will modify all contents over there. So you will get next content only in that. And FMG also we have a concise content. So you can start with a basic and you can go with your licensing exam. So yeah, this is a glimpse of our classes. But yes, this is a glimpse of MIST classes, and I am like explaining you the MIST next step. So MIST is the leading institute coaching in India for a licensing exam, for a FMG, or for a next exam, whatever the exam is. Definitely, we will taught you that tricks and tips like which you can use for your license to clear your licensing exam. So this is a graph of our result, which we are producing for last 10 years. And
Ma'am, sorry to
here,
say, ma'am, excuse me, ma'am. Sorry to say, are
yes,
you
sir.
presenting something? Presenting something is not visible, I think.
Okay, just a minute. Now screen is visible. Is it visible now?
Yes, ma'am.
No?
Yes, yes, ma'am.
Yes, ma'am. Now it is.
Okay. Yeah, so this is a graph of MIST and MCI result. You can check out, and this is a graph of our 10 years. This is starting by 15, but yes, we are producing result from since 2013 because MIST is started in 2012, and he is a Dr. Vineet Gupta, sir. And I really hope that you can know him, someone who can know him. He is a surgeon also, and he's teaching surgery in a MIST. And in MIST next step also, you will see him only teaching surgery. So this is a beautiful message from him to the students. So this is a Miss Next Step. You can use Miss Next Step for your MBBS preparation also. Like MBBS preparation, not like you are attending a classes. Sometime you missed your university classes, and for clearing your the exam of your university, sometime you need some tuitions or like this thing. So you can take a help with this app. So this is the feature why we are unique, and we have very concise classes, question bank. We have topic wise questions also. We have subject wise questions also, images questions also. We have a lot of huge question bank in a Miss Next tab. So and colored notes with a full of images. So no need to go here and there to find a image. Like you don't need to Google any image. You just found all images related the subject in a one book only. So these are the quality of Miss Next Step. World-class faculty you will get in a Miss Next Step. 24 into 7 support. If you have any doubt in any video, any question, any notes topic, you can contact us. Like you can mail us. You can there is an option also ask your doubt. You can contact over there also, and then you will get your reply. So these are the faculties, and I know like some students are already downloaded, and a few faculties you see in app they are different. Like physio in app as of now we have 3 faculties. now in app there will be a Naveen Gupta sir, Dr. Naveen Gupta sir. But yes, very soon you will see Dr. Arun Swami sir in Miss Next Step. So Silpi ma'am is teaching anatomy. Dr. Arun Swami sir will teach you physiology in Miss Next Step, biochemistry Dr. Shantan Saha sir, patho Dr. Kunal sir, micro Dr. Salman sir, pharma Dr. Saurabh sir, and FSM Dr. Atul Gupta sir, PSM Dr. Deepa ma'am, ENT Dr. Abhay sir, Ophthal Dr. Anuradha ma'am, and then medicine actually we have three faculties, and one part is taken care by the Kunal sir only, and surgery Dr. Vineet Gupta sir, who is the director of MIST and MIST Next both. Dr. Amit Gupta sir will teach you OBG, and Vindhya ma'am we will she will teach you pediatrics. Akshay sir will teach you orthopedics. Sandeep sir will teach you derma. Prashant sir will teach you psychiatry. Nishit sir will teach you radio, and Samir sir will teach you anesthesia. So these are the faculty who can you can see in Miss Next app. They will taught you your all 19 subjects. And yeah, these this is the plan for Miss Next Step. If you are looking for a plan, like if you wants to few videos, so you can if you wants to take an idea, you can take idea from the suggested videos section to purchase any app also. And these are the happy students from MIST. And this is a QR code. If any student want to download, you can scan this and you can download it. Okay, just a minute. Yeah, so this is a Miss Next Step, and as I told you that I have an offer for you guys. If any student wants to enroll in a Miss Next Step, I will share a promo code with you all, and if you use that promo code, then you will get 5% prices, the mentioned prices, and 1 month extra validity. So if you subscribe for a 6 month, you will get 7% discount. So I will share like the promo code to the sir. They will share. He will share you in a group. So this is a Miss Next Step, and I hope you all enjoy the quiz. And I'm just transferring this. And thank you so much, Dr. Soumya or Dr. Amritanshu. Please announce the winners, because I just want that you can announce the winners because they are friendly to you.
Thank you, ma'am. So we are
Thank you.
now at the end of the session. So before ending, I would like to announce the winners. So just wait a second before I share my screen. So I think my screen is visible to all of you. So here we are announcing the result of our cervical cancer quiz winners, and the first prize is goes to the Aditya Narayan Agrawal from the KMC. So please, everyone,
Round of applause.
unmute your mic and give a big round of applause for Aditya Narayan Agrawal.
Congratulations, Dr. Aditya.
Congratulations, sir.
Thank you, thank you. I would like to thank everyone and also the Mistab to provide the platform and Games Nepal to provide the opportunity. Thanks to all. The questions
Right.
were really good from Mist.
Thank you, sir.
Thank you,
So
thank you, thank you.
now it's turn for the second ranker. The second winner is the Radhesham Agrawal, Radhesham Yadav from IUM. Please give a big round of applause for Radhesham Yadav.
Thank you all, guys.
Now the third winner is the Archana Rajput, which is from UCMS. So give a big round of applause for Archana Rajput. Everyone, please. So these are our all three winners, and I think we will have more such quizzes and events coming up. And I that our team is like uh, do the great things. So this is a this is all for the today's session, and I think we should wrap up. And once
Yeah, sure.
again,
I
I
just want to add one thing. Who are the winners? Dr. Aditya, Dr. Radhesham, and Dr. Archana would be doctor. I just love to add doctor before the name because you all are would be doctors of India. So we will transfer your the winning prize in your account, and I will ask like Amritanshu, you can share them like my contact number, or you can like take their account details and forward me, and
Yes,
within
ma'am.
a
Sure.
working 3 days we will transfer the money.
Yes, ma'am. Sure, ma'am.
Thanks for the giving opportunity. Thank you so much.
Thank you. Thank you. Thank you so much. Thank you,
Thank you, man.
everyone. Wish you have a great luck, great success. Good night, everyone. Good night.
Good night. Bye bye.
Thank you, everyone.